Hello everyone, welcome to another lesson with Nursing Insight with Caleb Mlonga. So today we're going to look at nursing care plan for acute renal failure. We have looked at the nursing care plan for hypertension, then today we are going to look at the nursing care plan for acute renal failure. So we have identified 5 problems in our nursing care plan. So you can check out the pathophysiology for renal failure that we put out a couple of days ago. So our first problem is excess fluid volume. So in renal failure, you find that because of increased fluid retention, you will have a lot of fluid in the body, and that is actually our first problem. The nursing diagnosis: excess fluid volume related to compromised regulatory mechanism, which is renal failure, evidenced by generalized tissue edema and weight gain. So the excessive fluid volume is due to the compromised or the failing regulatory mechanism, which is the renal system. Our objective for this problem: to reduce fluid overload throughout hospitalization. So we want to reduce the fluid volume levels, the excess fluid volume. So we want to reduce it. Our first nursing intervention: I will accurately record intake and output on the fluid balance chart to monitor fluid retention. So I will monitor all the fluids that have been taken by the patient and all that is being excreted from the body, and I will record in the body to note. I'll record on the fluid balance chart so that I can monitor if there's fluid retention, if there is a big difference between the fluids that have been taken in and the fluids that have been released from the patient. The second intervention: I will weigh the patient daily to determine whether excess fluid volume is improving. So I will conduct daily weighing of the patient to actually determine if the fluid overload is reducing. So when the patient's fluid levels, the fluid retention reduces, in this condition, the weight will subsequently reduce. The third intervention: I will restrict fluid intake as prescribed to avoid more fluid buildup in the body. So I will restrict fluid intake as prescribed. I will only give the patient only few fluids. If it's IV fluids, IV medication, we'll make sure that we minimize introduction of fluids into the body, because remember, this patient already has excessive fluid volume. The fourth point: I will administer prescribed diuretics such as furosemide to increase excretion of excess fluid. So that is the last point, where we are administering furosemide, a diuretic that will increase excretion of excessive fluids. So from having implemented these interventions, we now have to evaluate our patient. Excess fluid volume has reduced, evidenced by reduced body weight and tissue edema. So you find that because of the interventions that we have implemented, there will be reduced fluid volume. Therefore, the body weight and the edema will reduce. So that is our first problem. Our second problem is electrolyte imbalance. So because of excessive retention, reabsorption of electrolytes such as sodium, potassium, and all these other electrolytes, you find that there will be increase in electrolytes in the body, and then we will have hyperkalemia, we can have acidosis, we can have all these other complications of electrolyte imbalance, and that's why we have identified electrolyte imbalance as one of the problems, the actual problems in acute renal failure. So electrolyte imbalance related to compromised regulatory mechanism evidenced by muscle cramps and irregular heart rate. So here you find that because there is more reabsorption of these electrolytes, which is because of the compromised renal function, there will be muscle cramps and irregular heart rate. Our objective for this problem, to maintain serum electrolyte levels within normal ranges within hospitalization or throughout hospitalization. So we want to maintain these, we want to maintain normal levels of electrolytes in the body, we want to balance them. Our nursing interventions. The first one, I will restrict intake of potassium to prevent hyperkalemia. So because there is increased reabsorption of potassium, I will restrict intake of potassium so that we can prevent hyperkalemia. The second one, I will monitor serum electrolytes and assess for presence of irregular apical pulse indicative of hyperkalemia. So you find that because of electrolyte imbalance, you have irregular apical pulse. So therefore, I will monitor serum electrolytes using laboratory measures and laboratory tests, and therefore note if we have any electrolyte imbalance. Our third point, I will give hypertonic glucose and insulin infusion and sodium bicarbonate to treat hyperkalemia. So we are treating hyperkalemia mostly because it is the most dangerous, or one of the most dangerous conditions that a person can have, especially in acute renal failure. So here you find that giving sodium bicarbonate to actually neutralize and reduce this hyperkalemia or any other electrolyte imbalance. So therefore, we administer it to this patient. Then the last point, I will educate the patient on the signs and symptoms of electrolyte imbalance to increase the knowledge of the patient. So here you find that when we educate the patient about the signs and symptoms of electrolyte imbalance, they will know, and that will be easier to identify and also for them to seek medical attention. So having implemented these nursing interventions, we're going to evaluate our patient. Serum electrolyte levels have been maintained within normal ranges evidenced by regular heart rate. So you find that now that we have normal ranges of electrolytes, the patient who have a regular heart rate, the patient who have no muscle cramps. So those are some of the symptoms that are shown in electrolyte imbalance. So that's about our second problem, which is electrolyte imbalance. We move to our third problem. Our third problem is deficient knowledge. Deficient knowledge related to inadequate knowledge on the condition evidenced by asking too many questions. That's our nursing diagnosis. Our goal or objective to improve the patient's knowledge about the condition throughout hospitalization. Our nursing interventions, I will allow the patient to ask questions and I will answer the questions accordingly to increase knowledge about the condition and allay anxiety. So I will allow the patient to ask the questions and I will answer them. I will explain the disease process to the patients to increase the patient's knowledge about the condition. I will teach the patient about prescribed dietary regimen to increase knowledge. So I will explain to the patient that we have to restrict foods that are high in sodium, foods that are high in potassium, so that we prevent increase in electrolyte imbalance, also more reabsorption of fluid. So we have to we have to educate the patient about these dietary modifications. Then our last point is I will teach the patient about medical regimen, including name of drug, dosage, reason for taking, and side effects to increase knowledge about the treatment of the condition. So here you find that I have to teach the patient. I have to explain to the patient about the medication, the type, the name, the dosage, the reason for taking, and the side effects, that they are aware and they know the type of medication they're taking. Having implemented these interventions, now we are going to evaluate our patient. Patient shows good level of knowledge about the condition, evidenced by patient asking questions about the condition, answering questions, evidenced by patient answering questions about the condition. So the patient will show that they have a good level of knowledge about the condition, and they will show by answering questions when asked about the condition. We move to our fourth problem, which is risk for altered nutrition less than body requirements. So here you find that because the patient has uremia and all these other symptoms, you find that there is usually anorexia, nausea, and sometimes vomiting in this patient. So there is a risk for the patient to actually develop malnutrition or nutrition less than body requirement. The nutrition will be altered. So our diagnosis is risk for altered nutrition less than body requirement related to dietary restriction, or it can be related to anorexia, or it can be related to nausea and vomiting. our goal for this problem, patient will have a good nutritional status throughout hospitalization. So we want to maintain a good nutritional status throughout hospitalization. So how do we maintain this good nutritional status? One, I will provide frequent small feedings to minimize anorexia and nausea associated with uremic state, or to diminish or diminish peristalsis. So here you find that when you give the patient small frequent feeds, you find that that will help in minimizing anorexia and nausea. Therefore, the patient can eat and improve their nutritional status. Second one, I will provide high calorie, low protein diet to meet caloric needs and essential amino acids needed in the body. So you find that in our patient, we cannot give foods that are high in proteins, because when the proteins break down into amino acids, you find that there will be waste products that will be produced, and those waste products will go in the body and increase the uremic levels, the toxin levels in the blood. Therefore, we have to restrict a protein diet. So here we are going to give high calorie diet, which will provide the body with calories and the much needed amino acids. The third point, I will give nutritional supplements to provide the needed nutrients. So here we have to give nutritional supplements so that we can improve the nutritional status of the patient. The fourth point, I will consult with the dietitian support team to come up with a dietary plan suitable for the patient. So here you find that because we have so many restrictions on this patient, we have to consult with dietitians, a support team that will help us to come up with a plan that will be actually important, that will help the patient to have a good nutritional status. So we have to consult so that we can come up with a proper dietary plan for the patient. Then here we had 5 points, and our last point is I will assess and document dietary intake to identify dietary needs. So here you have to assess and document the type of foods that the patient is eating, so that you can know what the patient actually needs, or the type of nutrients that the patient is lacking. Then, having implemented these measures, now we are going to evaluate our patient. Patient has good nutritional status, has had good nutritional status throughout hospitalization. So here you find that our patient will have a good nutritional status throughout hospitalization. Then our last problem is risk for infection. So as you know, in acute renal failure, you find that because of alteration in the renal system, there will be depression of immune system. So, and the depression is due to, or secondary to, uremia, which is increased toxins in the body. So our diagnosis is risk for infection related to depression or immunologic defenses secondary to uremia, or you can just say risk for infection related to depression of immunologic defenses. That's our diagnosis. Our objective or goal: patient will not express any signs and symptoms of infection throughout hospitalization. So we do not want the patient to exhibit or experience any signs and symptoms of infection. So now we are going to put interventions, to carry out interventions to prevent the patient from experiencing any signs and symptoms of infection. The first one, I will change sewed linen to promote comfort and prevent infection. So I will make sure that I do bed making and change the sewed linen that can be a source of infection. Second one, I will wash hands before and after handling the patient to prevent infection. The third one, I will administer prescribed antibiotics for prophylaxis. So I will give with caution antibiotics such as amoxicillin for prophylaxis. Then our last point is I will ensure that all the equipments being used for the procedures on the patient are sterile to prevent introduction of infection. So you find that if you use non-sterile equipment on the patient, you might introduce infection of bacteria into the patient's body. So therefore, you should make sure that all the equipment that are being used are clean, sterile, there are sterile equipment so that you do not introduce infection in the patient. You can also add another point, which is I will use reverse barrier. Reverse barrier nursing, this is a protective measure where you protect the vulnerable patient from acquiring infection. So this is where you isolate the patient, for instance, so that the patient will not acquire infection, not that the patient is the source of infection. So you can employ reverse barrier nursing to prevent infecting the patient as another intervention. So having implemented these interventions, we will now evaluate our patient. Our evaluation: patient has not experienced any sign and symptom of infection throughout hospitalization. So here our patient now will not experience any problem, any sign and symptom of infection throughout hospitalization. So we have looked at 5 problems, 3 actual problems and 2 potential problems. We have come to the end of our lesson. Today we have looked at the nursing care plan for acute renal failure. So continue watching our videos, like our videos, comment on our videos, and share so that more people can watch our content. Thank you for being with us. See you next time. God bless you. Bye.